In this section, we're going to be talking about somatoform disorders. In this section, there are 5 different disorders which are under this umbrella. The first is somatization disorder, the second is conversion disorder, then hypochondriasis, body dysmorphic disorder, and pain disorder. So these are some generalities when looking at the somatoform disorders. They all generally have physical symptoms, okay, such as pain or maybe loss of sensory in some of them. So those are some physical symptoms. The second thing is that's a diagnosis of exclusion. Okay, so they've already done the MRI, they've already done CT, they've already done the CBC, they've already done all the tests, and there's no other reason for it. So that's a diagnosis of exclusion. There's no identifiable physical cause. The third thing is that it is not intentional. Okay, so these people are not trying to do it. If they were trying to, then it would be malingering. Okay, but they're not. It's not intentional. Fourth thing is that there are unconscious drives, and that is illness production and motivation. And finally, it's important to know that it is more common in women. In somatization disorder, you have 4 pain, 2 GI, 1 sexual, and 1 pseudoneurologic symptoms. Okay? And the very important thing about this is that it is a long-term process. Okay? So this has been going on for years. And you actually do have to know the numbers for this because you might see it in the vignette. So remember, as I said, there's no it's a diagnosis of exclusion. There's no physical causes that you know. Okay, it's not intentional. Okay, but the way they remember 4 pain is all you have to do is just draw a person. Okay, and usually the pain will probably be in the limbs. Okay, so how many limbs are there? There's 1, 2. There's 3 limbs. So that's how I remember that there's 4 pain symptoms. There's 2 GI. Well, you know that there's like an upper GI system and a lower GI system. So that's how I remember that there's 2 GI systems. And then 1 sexual. Well, you usually have 1 sexual organ, so so that's the 1 sexual system. And then finally, the way I remember is that you think, oh, somatization disorder, it's all in your head. You only have 1 head. You only have 1 brain. Okay, so that's how I remember it's 1 pseudoneurologic. And remember, it's a long-term process. So again, 4 pain, 2 GI, 1 sexual, 1 pseudoneurologic, and it's over a long-term process with all the qualities I listed before. The next one we're going to talk about is conversion disorder. This is a lot like somatization disorder, except that it is a sudden loss. Okay, and there is an identifiable acute stressor that accompanies it. And so, for example, a divorce or a death of a loved one, something that may cause conversion disorder. Again, remember, there's a diagnosis of exclusion. There's no identifiable physical cause. Okay, but there is identifiable acute stressor. The other important thing you have to know about this is that it's a loss of sensory or motor. Okay, it's a loss of neuro symptoms. Okay, it's not going to be sexual or anything. It's a loss of neurological symptoms. The other weird thing is that a lot of these patients are indifferent, that they have these symptoms a little bit. And the other thing is that it's more common in adolescents and young adults. So maybe it's their mom bringing them in, okay, and then maybe it's their parents bringing them in because they notice this, because they are indifferent to it, and it's a sudden loss. And remember, it's not malingering. It is not intentional. Some of the if the kid comes in, some of the neurosymptoms, it may manifest itself as paralysis or blindness or mutism or something like that. The next one is hypochondriasis, and this one's not too hard. I think we all know what this one is. So it's a preoccupation and fear of having a serious illness, okay? And as it says, it does not subside after thorough medical evaluation and reassurance. So these people think they have this illness, and they come in over and over and over again, even though all their tests are negative and the doctor says it's negative. They're very, very concerned about it. Okay, so these patients will commonly come in all the time. It'll say in the vignette like they've come to the doctor's office several times in the last year. So that's what a hypochondriac is. So this is body dysmorphic disorder. When I said hypochondriasis is preoccupation with a serious illness, then body dysmorphic disorder is a preoccupation with a minor or imagined defect, okay? So I always think about maybe an adolescent, okay, who's preoccupied with a defect in his nose or something like that. And maybe there is a small defect or could be completely imagined, and this person is very, very preoccupied with it. And they have impaired functioning, okay, maybe they're afraid to go out, they have a lot of phobia for going out, a lot of distress about it, and they're constantly seeking cosmetic surgery, okay, so they constantly want cosmetic surgery. So that would be body dysmorphic disorder, when there's an unreasonable preoccupation, unreasonable, wanting to change a certain part of their body. The last one is pain disorder, and this is chronic pain exacerbated by psychological factors. So in this one, pain is the dominant symptom. So this is where you have someone who's had maybe back pain for a while. You didn't find any reason for why they had back pain. They just had it for a while, and then they go through a divorce and it gets worse. Okay, maybe they lose custody of their kids and it gets even worse. I mean, who knows? But it's basically exacerbated by psychological factors, and if those factors play an important role in the severity and the maintenance of the pain also. So again, no identifiable cause, no intention, but the pain is chronic pain that happens. It gets better and worse. It waxes and wanes with their psychosocial situation. So again, just as a quick review, somatization disorders, remember, a person. So we have the 4 pain symptoms, okay, the 2 GI. Remember, so there's 4 limbs, upper and lower GI is 2. There's 1 head, so 1 pseudoneurologic symptom, and 1 sexual symptom, okay, for a couple of years. So this is chronic. So if we kind of group these together, so this one is chronic, okay, and then the next one is conversion disorder, and that one's acute stressor, but it's only neurological symptoms, okay, and this usually occurs in young people. Hypochondriasis we can kind of group these guys together too. So hypochondriasis is when you're worried about significant, serious illness, even though you have tons of reassurance that you don't actually have it. Body dysmorphic disorder, on the other hand, is preoccupation with like a single physical feature, okay, like your nose or something, and you're very preoccupied, and that impairs your daily life, and you're not able to go outside and stuff like that, and you seek cosmetic surgery. And finally, we have pain disorder, which is this chronic condition where you have pain that becomes better or worse with your psychological condition. And that's it for somatoform disorders.